Okay, thank you once again to our panelists for this fantastic discussion on policy and the challenges. We're taking a break now from now until 10:50, and we will then go directly into our breakout sessions. There are three of different considerations. All of them are around the theme of decision support tools for use in countries with policymakers. The first group is in the Awash room, and this is where Guru Madhavan will be talking further about the SMART tool developed for vaccines and thinking about its application to ECD. So the Awash room is over near the atrium on this floor. So after the break, you'll walk directly over there. The second one is Constanza Alcaron talking about tools in Colombia. That one will be right here. So if you're part of that group, just keep your seat. The third one, led by Ann Maston, will be in the patio room, which I understand is right through this door here. So again, we're convening back at 10:50. You'll go directly into your groups. The lunch will be served at 12:15, and that's about when I think the group work will probably end, unless you're like really into it and you want to go grab some food and go back to your group. And then when we next convene together, it will be at 1 o'clock in this hall for report outs from the breakout sessions. Okay, thank you. Enjoy the break.
Announcement, and then we'll start the session.
As with the rest of our workshops, we're collecting reaction videos, which are just short 30-second to 1-minute videos that I'll record, and one of the other staff is helping me. So we have a short break this afternoon, and if you can, I'll be outside in the atrium. So if you have just initial reactions, concluding reactions, just whatever comes to mind, we'd love to capture those, and we post them on our website, and we do these as we move around the world.
So thanks for being back here, more or less on time. We'll have 20 to 30 minutes for this session, and we'll try to catch up so that we can start the next session. Tools, and finally, Kolani Magongo from Swaziland will present the work on the ECD planning tools. That is a group that has been led by Ann Maston before the break. So without any further ado, let me turn it over to Guru, 5 to 10 minutes.
Thank you very much, Simon. And I don't have slides, so please look at me. So I was fortunate to be in this breakout session that focused on this decision support tool that we have developed at the Institute of Medicine and the National Academy of Engineering. It is called Smart Vaccines. In short, as an expansion, strategic multi-attribute ranking tool for vaccines. It is a strategic planning tool. It won't make decisions for you. It is only going to assist your scenarios by bringing in a variety of factors into plain view. And I think that is one of the significant benefits of taking a systems analysis approach that has been widely used in the world of urban planning, defense, acquisition, nuclear waste management, and so forth. So what we have done is essentially borrow those ideas and apply it to a very narrow domain called vaccines. And just to give you a little bit of background on smart vaccines before we go into the bigger portion of the breakout, smart vaccines was developed under the request of Department of Health and Human Services of the United States. And the work began after the National Vaccine Plan was launched 5 years ago. And the first and the foremost objective in the National Vaccine Plan was to help prioritize new and improved vaccines. How do you do that? And there is no single method to do that, and that's why we ended up creating a software system, which is the first of its kind for the National Academies, and we ended up taking a multi-criteria systems analysis approach that would enable a wide range of decision makers to incorporate their preference structure into the decision making framework, especially when it involves multiple stakeholders with varying and even conflicting objectives. So I think that is something that I've been learning in this meeting as well. So as a policy tool, Smart Vaccines is able to, for example, take the analysis beyond cost effectiveness, which is a very powerful technique, but it is incomplete. And by bringing in public concerns and other programmatic aspects and everything, you're able to enrich the analysis. And I think that is something we demonstrated and we discussed during the breakout session. The second aspect is the is a significant benefit, which is discussion facilitation and even negotiation support. For example, a finance minister might use a tool such as smart vaccines and come up with his or her own priority list, and health minister might approach it completely differently, and you might have two very different lists. How do you now convert the potential discordance into concordance? And I think a tool like Smart Vaccines gives you a complete transparent platform where people can see through what the other person has done, what the value structure is, what the input criteria is, even the population definition, disease criteria, and the intervention profiles and so forth. And then they could have an informed discussion and so forth. So we try to apply this idea to create something called Smart IYCG. And it's not an easy task, as you all know, because it is not a narrow task as vaccines. So we spent a lot of time talking about it, and I think the general consensus in the breakout was there is potential for bringing systems analysis approach into IYCG if we are able to agree upon a minimum list of interventions that could go into it. And it was immediately clear that these interventions cut across a variety of sectors. So that's something that we need to think about very carefully. The second one, what are the core set of attributes that you could rank and weight? So to rank and comparatively evaluate these interventions. So that's very important. And finally, how are we going to determine the weights? Because that is a collective effort. If I use the tool and I get my own results, it's fine, I'm happy. Similarly, every one of you could come up with your own results, but that's not the point here. How do we collectively agree upon these things and come up with a master list of interventions that could be broadly helpful and beneficial? So those are the three big things. We also talked about data, but not too much into this because we know it's always a perpetual headache. So we just want, our goal is to build a minimum viable model with limited number of attributes and limited number of interventions and go from there. And to conclude, I would wish to quote Demisi Hapte, you have to start somewhere and let people play with it and decide how to go from there. And that is the core of user-centered design. Thank you.
I will try to give the strong ideas because Constanza Alarcón gave us a very wonderful presentation, very complete, with a lot of details in terms of how the Colombian policy for early child development is in the process. Then the focus of the presentation was on the national policy about early child development coming from the government. This is a particular issue because it's up to down, you know, the policy. The experience is it shows us how to design and implement a national policy. First of all, she gave the context of Colombia. They have around 5 million children, a very diverse country in terms of culture, ethnicity, geographical situation, socioeconomical situation. It's a very inequitable country. 60% of the population of the children are in poverty and 25% in extreme poverty. In spite of the ratification of the Convention of the Right of the Child in 2006, the coverage of a child programs were very low, as well as the quality. No standard defined, without a conceptual and strategic framework. Internal violence is a cross issue that is a the long-term process of violence because they have something like an internal war with a group of extreme, I don't know how to say, but this is an army group that into the country, and then this is a particular issue that work against the possibility to improve the situation. The name of the policy is From Zero to Always. From Zero to Always, ¿está bien? It's a wonderful name. From since 210 is the beginning of the process. Constanza is in charge of that from the beginning. some characteristic of this Colombian policy is the comprehensive development, universal, specific action for the most vulnerable children. The idea is to put the policy for all the children, but of course, the most vulnerable with the specific interventions. The other focus is the idea to have an integrated policy with an intersectoral approach, and a commission was conformed to work all the stakeholders or the sector and actors to be coordinated by Constanza and her team. And the other idea is that intersectoral from up to down, but with a very, very important development in the local level. Okay? One of the first issues to put on the table was a roadmap. A roadmap to identify the milestone and the coordination from the presidential office to have the integrated approach, health, education, community, families, others. Go, Elsa. Well, two moments are very important. The first moment is to identify the age of the group from preconception and gestation to 3 to 6 years. I'm not sure if you say, which is the cut? 4 or 3 to 6 is too much? Okay. Recipients according to the age group, which are the different interventions to be implemented in the different age groups. 8 interventions were a priority because you cannot do everything at the same time, but 8 interventions. Birth certificate, because many children are born there and without the birth registration. All children with access to health care, with insurance, with a family training process. All the children attend an ACD unit service with certificate, with quality, with an staff with the quality. Complete vaccination scheme to his or her age. Attend growth and development consultation, nutritional assessment, and the 8th, I don't remember. It's okay? Access to collection? Okay. Of books, materials for education. The institutional competence were defined for different sectors, child at the center, and the different sector and actors around, putting all the resources and the smart ideas. Establishment of decision-maker tools for national and local level. Tools at national level is a very important registration system. An integrated system that allows follow each child, pregnant woman, clinical files, alert, scholar data, and others. 8 indicators are selected and monitoring. The system allows for geographical reference of the children and can generate a mechanism of alert. Tools at the local level. Important to have some format to make the diagnosis of the local situation of health and other indicators, to prioritization of care action at the local level based on the comprehensive care roadmap, identify the order of service, identify the sector for the action, and allow monitoring. Who use the tools? All the stakeholders, all the staff in the local level and in the national level. Go. Yeah. She gave 2 examples, one for a municipality, Soledad is the name of the municipality, another from a department that have a lot of municipalities. Then it's a small local level, a big one, given the different experience to improve the indicators and to improve the monitoring. Which are the main contributions to the forum from this experience? I can capture these 5 ideas. Experience in terms of scaling up, it is important to consider the loss of quality that can happen from transition from a project to a national policy. Tools are simple, must be simple and practical to build. Not every tool is good for every country. Tools appropriate for different levels and to generate support platform to support countries. I try to synthesize a very long presentation, very complete, but I try to be summarized.
In your Dropbox, there is a manual that was shared by Emily Vargas. It talks about ECD, a policy planning tool. And in the group that we were with, we were just looking at that manual, and we just talk about a few things that we need to go through. So at first, it talks about the audience of the people that are going to be using the manual. And it says that the process is for people that are working on policy development. And anybody else who is interested in policy development can use that process or that tool. So it is used together with other decision-making tools that you might already have. So one thing that I would like to highlight is the manual itself, what it contains, the context of it, the justification of having an ECD policy in your country, the history, the principles of an ideal ECD system, the guidelines, then there's an activity checklist just to see what we have to go through when developing a manual. Then it also has some resources that you can use when you have a policy. So on the phases of development of a manual, of a policy, you've got the preparation phase, and you want to consult with people as you are preparing. And so you also have the ECD situation analysis that you can do in your country. And then you can start with the consultation at community, at regional, and at national level of the people that are involved or will be touched by that policy. And then you can go for a policy draft and consensus building. And then the fifth one is the policy approval and adoption. So we were just going through those processes and looking at each of them and trying to find out and reflect as to what we can learn from this process that Emily has put together. So on our reflections, I will just share some of the things that we discussed, whereby some of us felt like it's very important to have a policy in place because some countries, they do have a policy, but you find that that policy is not inclusive. It's just a policy that was developed by government, and it did not involve anybody. So for a policy to be adopted and used, it has to involve the people that we work with on the grassroots. So it's very important to involve people. And we also need to appreciate how important it is to have a policy in place, because you can actually work without a policy. Some organizations, they've gone to the extent of implementing without a policy in place. And the problem with that is that you are not working against anything. You are just working because you have the support or the funding that you have. So the issues that we need to talk about when it comes to try to make sure that people understand the importance of a policy in place. And the other consideration is the cost. Too many times when we develop a policy, we just look at the development of the document itself. But at some point, the document will need to be implemented. So we leave out that implementation phase. And you find that in most cases, the implementation phase is the thing that's the most important, and yet we don't have funding for it. So we need to look at the cost itself, and when we develop the policy, put in the cost so that you are able to go through, even to the point where we are implementing. So we need to set aside adequate resources and make sure that those resources are available to the people who are developing those policies in our countries. And what is needed, we've already alluded to the issue of costing. You need to make sure that you thoroughly cost the policy of, the process of development of a policy. And also we can work together in what is called public-private partnership, try to work with the private organizations and see how they can put in something so that you are able to go through the process. And there was an idea of a policy simulation tool, something that can show you from the start, if you want to go through this process, these are the things that you need, and these are the costs that you have to incur so that you are able to prepare for everything from the beginning. What you have here is a slide of an activity list, which may show you as to what has been done and what has been completed. So using that activity list, you can be able to say, this is where we are as a country, and moving forward, you follow those steps. So we found that those steps were very important, and we think that they should be adopted in our programs as we move on with policy development. Thank you very much.